Globally, there has been an astounding escalation in rates of obesity in both adults and children in the past 33 years, with the total number of individuals affected climbing from 857 million in 1980 to 2.1 billion in 2013. With obesity skyrocketing worldwide, for those who have tried to lose weight and sustain weight loss the traditional ways, surgical intervention may be the only answer. Over 34 million adults in the United States are overweight with a BMI of greater than 25, with 5 to 11 million being morbidly obese. Obesity is responsible for over 300,000 deaths annually. Some comorbidities associated with obesity include diabetes, depression, arthritis, hypertension, sleep apnea, hyperlipidemia, and heart disease, to name a few. There are also certain cancers associated with obesity, including colon cancer, cervical, breast, uterine, ovarian cancer, as well as prostate and esophageal. After modifiable options or factors have been exhausted, surgical intervention may be the only viable answer for some patients. Two of the most common strategies for weight loss surgery include gastric bypass and the ventral sleeve gastrectomy. The most commonly performed bariatric surgery in the United States is the gastric bypass, which creates a small upper stomach pouch that is then attached to the jejunum, resulting in bypass of the duodenum and the rest of the stomach. The ventral sleeve is typically done laparoscopically, but sometimes done during an open procedure to generate weight loss through gastric restriction. Approximately 80 to 50% of the stomach is removed and made into a new, smaller stomach that measures 1 to 5 ounces, leaving the remaining stomach shaped like a slim banana. As nurses caring for these patients postoperatively, we need to be aware of 3 postoperative complications. The first being the anastomotic leak, which includes signs and symptoms of abdominal pain, hypoxia, left shoulder pain, diaphoresis, tachycardia, tachypnea, fever, oliguria, and increased drainage output. Respiratory complications may also take place due to the inability or decreased respiratory status. These symptoms include fever, diminished breath sounds, increased white count, sputum production, decreased oxygenation saturation levels, tachycardia, which could be a sign of atelectasis, or pneumonia. The third complication includes deep vein thrombosis, which is a clot that usually forms in the lower leg. This clot can break loose and travel to the lungs, possibly blocking blood vessels, causing respiratory complications and or death. Those signs include tachycardia and tachypnea, which are both seen in the leak, and including chest pain or shortness of breath, hypotension, leg pain, and fever. It is possible for a patient to have a DVT and be asymptomatic. In that instance, if a DVT breaks loose, it can cause a pulmonary embolism, which can lead to death. Symptoms of pulmonary embolism include sudden or unexplained shortness of breath, chest pain that worsens with deep breathing or coughing, feeling lightheaded or dizzy, tachycardia, sweating, fever, or a sense of anxiety. To reduce the risks of postoperative complications, early ambulation is key. Most physicians suggest ambulation within the first 2 to 4 hours upon returning to the unit. Also, pharmacological thromboprophylaxis, including Lovenox and heparin, is also ideal. But the number one preventative measure for postoperative complications is deep breathing. And to contribute to that is the use of the incentive spirometer. Typically, patients are instructed on its use and advised to complete these exercises 10 times every hour while awake. Educating the patient on these safety or precautionary measures is ideal to preventing postoperative complications. A great deal of teaching that needs to be done with bariatric patients after their surgery and before they go home. Bariatric surgery is not like other surgeries that fix a problem. Bariatric surgery is a change in the way of the patient's life. Some important aspects of discharge teaching include diet progression, vitamin and protein supplements, adequate hydration, progression of activity, and pain control. We also want to advise the patient of warning signs, things that can present a potential problem while at home, including difficulty breathing, chest pain, vomiting, fever, epigastric pain, abdominal pain, signs of wound infection, leg infection, and the importance of follow-up appointments.